All right, my name is Ryder Kinchlow, and this is my therapeutic communication video. So in my situation, my client is 22 years old. Her family brought her in today into the ER for worsening symptoms of depression. The client states that she stopped taking her home medications for depression because of weight gain. So in this video, I'll be demonstrating therapeutic communication techniques, explaining the importance of medication compliance, and assessing the patient's mental status. Also in this video, I'll be demonstrating techniques such as open-ended questions, paraphrasing, open body language, and empathy as well. All right, so I've assessed the scene for safety, and I've also performed hand hygiene. All right, my name's Ryder, and I'll be your nurse for the day. So what seemed to bring you in?
I'm just really sad and depressed.
What's making you feel that way?
I think it started when I quit taking my medication.
So what made you stop taking your medication?
I was just gaining a lot of weight, and in the past couple of months I've gained over 10 pounds, and I just couldn't handle it anymore.
I understand that that can be hard. Do you want to go into a little bit more further detail on that?
Yeah, I just got really insecure about myself. All of my clothes stopped fitting as well, and I just felt really like I didn't look good anymore.
I'm sure that's been really hard for you. So I'm going to go into a little bit more detail on the importance of some of the medications you're taking, okay? So your medications, they kind of keep you from going into like a further mental distress.
Mm-hmm.
And the side effects of them are a little bit of weight gain, but there are things that you can implement in your lifestyle, like exercising or whatever, to kind of offset that a little bit. But if you'd like me to, I can talk to your health care provider about changing some of your medications, and hopefully that may sort some stuff out too.
Okay. That sounds good. If you could help me fix the weight gain, then I wouldn't care to take them anymore.
Okay. So I'm going to ask you a couple questions, okay?
Okay.
Can I get your name and date of birth?
Yeah, it's Taylor Von Alman, and it's 11/08/01.
And are you feeling any pain today?
No specific pain.
Okay. And on a scale from 1 to 10, how much mental distress would you consider yourself being in?
Probably a 9, just because I'm so sad and depressed, and I'm also feeling so insecure about myself.
I'm sure that's been very difficult for you. So are you having any sleep changes or anything like that?
Yeah, I just feel like I can't fall asleep at night, but I'm always exhausted, and even when I do fall asleep, I'm still not rested in the morning when I wake up.
So you're saying that these sleep changes have kind of turned into some energy level changes as well?
Yeah, I have almost no energy. I can't hardly be around anyone because I'm so sad and just have no energy to do anything.
So are you having any feelings of harming or killing yourself?
No, I'm just really sad. I feel really hopeless.
Okay. And what is your desired outcome today?
Probably just feeling better about taking my medication, but also just not feeling bad about how I look.
All right, so now I'm going to ask you a couple questions about your diet. So how many meals would you say that you eat in a day?
Sometimes I just eat one. Sometimes I'll eat 2, but I usually don't eat that much at those meals.
Okay, and what do those meals consist of, usually?
It's usually stuff that's not very strong, like very seasoned, because my stomach is kind of upset for me feeling worried about my weight all the time. A lot of times it's just bland food or just fast food.
Okay. And usually whenever you're eating those meals, what do you drink?
I usually just drink soda or, I don't know, sweet tea.
Okay. And do you exercise regularly or anything?
No, not usually.
Okay.
If I'm feeling up to it, I'll go for a walk, maybe to walk my dog, but that's about it.
And do you see a therapist on a regular basis?
Yeah, I do.
Have you contacted your therapist about these problems that you're experiencing right now?
No, they haven't been able to get me in this week, but I had planned to tell them.
Okay. All right, that sounds good. So, how is your home life?
It's okay. My mom is there for me for sure, but it's just me and her, so we both have to do most of the stuff around the house.
Would you consider your mom to be a good support system?
Yeah, she is. I just don't tell her that much stuff.
Well, it is important to have a good support system especially when you're going through things like you're going through. All right, so back to your diet. So it would be probably a smart choice to implement more leafy greens and maybe watch, because fast food has a lot of calories and everything, and it's not really that great for you. So that could be aiding in that weight gain that you're experiencing. So it would probably be a good idea to cut back on the fast food and eat more greens and maybe watch your calories a little bit too. Also, maybe start implementing a little bit more water into your diet as well. That should help with maybe some of the weight loss. And also with exercising. So it helps your mental state a lot if you exercise at least 2 to 3 times a week. All right, so your healthcare provider has your home medications ordered for you here in the hospital. After me teaching you and everything, would you like to take your home medications?
Yeah, I will this time.
Okay. I'm just gonna let your provider know about our conversation that we've had here and everything, and I'll be back with your medications here shortly.
Okay.
All right, I've came back with your medications. Let me scan them real quick. And can I also get your name and date of birth?
Taylor Von Allman, 110801.
Okay, can I scan your wristband real quick? All right, can I get you anything else before I head out of here?
No, I don't think so.
Okay, well, here's your medications.
Okay.